Welcome to ET Times. I am Jenny Lewis. Many people experience coughing and sneezing in the fall, but in 2020, not only do we need to be aware of whether we have the flu or seasonal allergies, but a little coughing can raise fears about whether we have the new coronavirus. So if you're not feeling well, how do you know if it's a cold or seasonal allergy, or if you're infected with the new coronavirus? Although the symptoms of many seasonal diseases are similar to metastases, some key differences remain. Neoconjunctivitis is a respiratory disease, so symptoms are concentrated in the lungs. For many patients, cough and fever are the primary symptoms, while other symptoms include fatigue, dyspnea, sudden loss of taste or smell, body aches, and sore throat. Some patients may vomit or have diarrhea, but this is uncommon. According to the NHS, the main symptom of the virus is a feeling of warmth on the chest or back, sometimes without the need to take temperature. Constant coughing for an hour or more, or 3 or more coughing episodes in a 24-hour period. Loss or alteration of the sense of smell or taste has been noted in the person's inability to smell or taste anything. Or if you smell or taste something different than normal, health authorities explain that most people infected with the virus experience at least one of these symptoms. According to the World Health Organization, experiencing severe chest pains, severe shortness of breath or speech problems, and difficulty moving are all serious symptoms of infection and require immediate medical attention. Influenza is also a respiratory illness, so many of the symptoms are the same as contracting the new coronavirus. If you think you have the flu, because some of the symptoms are very similar to those of an infected person, the USCC's website states that a viral test may be needed to help confirm the diagnosis. Influenza, which is often accompanied by a headache and a sudden loss of taste or smell, is more likely to be a neocoronavirus infection. Neocoronavirus. Compared to the flu, the regular flu is much less severe, usually does not have a fever, and is characterized more by sneezing and a runny or stuffy nose. CC data show that most people who get the flu rest and recover completely in about 7 to 10 days, but people with compromised immune systems can develop more serious illnesses, and sneezing and a runny nose are also considered potential symptoms of neocoronavirus infection. Sneezing and a runny nose are also considered potential symptoms of neocoronavirus infection. The infection self-assessment tool for the Ontario and Hebei provinces both recommend getting tested for the virus even if you just have a runny nose or sneeze. Get tested for the virus as well. Seasonal allergies are sometimes colloquially referred to as hay fever. Seasonal allergies are not caused by any one virus, but rather by aerial pollen, usually in the spring or fall. These allergies simply affect the nose, and if the only symptom is a runny nose and seasonal allergies are usually present at this time of year, it is still best to contact a doctor for a checkup or use the provincial or territorial infection self-assessment tool. For those who are in school or work in jobs with frequent human contact, it is best to get tested as soon as possible after the onset of symptoms.